Good morning, everybody. Thank you for joining us for our Northern Light Health Good Health is Good Business Conference. I am thrilled to welcome you as we dive into the topic of artificial intelligence in the workplace. With AI accelerating across the globe, how can Maine employers equip themselves with the knowledge and expertise to safely venture into the AI space? And what considerations would remain top of mind as they navigate the new technologies? Today, we will ask our panelists these questions and explore AI's impact on Maine's workforce, business operations, and consumer experience. I'm Karen Hawks, Vice President of Operations for Population Health at Northern Light Health, and I'll be your moderator for the next hour. Please join me in welcoming today's panelists. We have Dr. Jim Jarvis, Senior Physician Executive for Northern Light Health and Director of Clinical Education at Northern Light Eastern Maine Medical Center. Dr. Jarvis will provide us with a brief health update prior to our AI panel discussion. Our AI subject matter experts today include Dr. Dan, I always say doctor, but Dan Kolosky, Head of Learning Programs and Professor of the Practice at Northeastern University's Roux Institute, Lacey Kowali, Director of Care Management and Coordination for Penobscot Community Healthcare, and Dr. Michael Ross, System Chief Medical Information Officer for Optum Insight, which supports Northern Light Health, and he's also a general pediatrician at Northern Light Health. Before we get started with today's panel discussion, I will read our legal disclosure. The information presented in this session is provided for educational purposes only and is not meant to substitute professional or medical judgment. Northern Light Health does not know the particulars of your situation, so the information presented today is intended to be general in nature and may not apply to every individual situation. Northern Light Health and the presenters make no guarantees or warranties regarding any information provided. This hour is intended for you, and we welcome and encourage your questions at any time using the question and answer feature. We also want your feedback, and I hope you each will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Before we move to our panel discussion on AI, I'd like to welcome Dr. Jim Jarvis to provide us with a brief health update. So welcome, Dr. Jarvis.
Thank you, Karen. Appreciate being welcomed back. As some of you know, I've been doing these for quite some time now, but it has been a little bit of a pause. And so I just want to give an update on a couple of things that have just been making the news really over the last few months. The first one is about measles, and that's because we've seen a significant rise in measles this year over the last few years. If you look at the graphic on the left, that just shows us which states in the United States have had cases of measles, and the darker shade of blue indicates the higher prevalence of the measles cases. And you can see that Illinois is really the hot spot, and that really was around Chicago. The good news is that those cases have been declining. So if we look at the graphic on the right, you'll see that while we did have a peak about a month ago, you can see that has been a steady decline. And that really does have to do with the fact that the people in Chicago really understood that there was a crisis there, and they actually vaccinated far more children than they had vaccinated pre the beginning of this year when we saw the measles outbreak. So it looks like measles is on the decline, but it's certainly something to remind people that vaccination is extremely important so that we can keep this under control. Here in Maine, the vaccination rate for measles is actually quite high. The way the CDC determines whether or not a state has, or a particular area has good prevalence of vaccination in order to have herd immunity, we look at those children who are entering kindergarten. And for the children entering kindergarten this year, so they're almost done with this particular year, we had an exceedingly high vaccination rate, which is good news. It means that if we were to have a case of measles in Maine, the likelihood of us having rapid spread is relatively small. So good news for all of us. Next slide, please. I also want to talk about brown-tail moth caterpillars. This is the time of the season where brown-tail moth caterpillars are active. They are currently active across the entire state of Maine. The caterpillars typically are active from April through early July. And I want to remind people, it's the hair on the caterpillars that is the offending agent that causes that nasty rash that we have. And you can see in the pictures there what those kind of hairs look like. They're quite long, and they do cause much of the problem. It is not the moth itself, it is their caterpillar. But the thing to remember is that they shed these hairs, and the hairs can remain in the environment up to 3 years, and they can continue to cause that nasty rash during that entire time, though they lessen the severity as the time goes on. But that's really where the concern is. So how can we protect ourselves from this? The best way is to just avoid places that are heavily infested with caterpillars. So if you usually walk in the woods and you see these kind of big white nests with a bunch of caterpillars in them, that's an area to stay away from. Coming home and taking cool showers and changing clothes after any activity where you might have been exposed to brown-tail moth hairs. Drying your laundry inside during June and July to avoid the hairs floating through the air and sticking to your clothes. I know this is the time of year people like to dry their clothes outside because it's frankly good weather for us, but it's actually not a good idea. And if you do have to be in an area where there is a large infestation of caterpillars, you might want to wear a respirator, goggles, coveralls, or that is tightly closed at the neck, wrist, and ankles when you're in activities where hairs might be flying around, such as mowing, raking, weeding, whacking, and even just taking down the webbing. Performing these tasks on a damp day or spray down the vegetation with the hose may actually lessen the likelihood that those hairs will fly out. So next slide, please. I'll also put in a plug that Northern Light Health Pharmacy does have some over-the-counter remedies for those people who do happen to get that rash and it's really nasty. So you may want to reach out to your provider or to Northern Light Health Pharmacy to see if there's something can do for you. I do want to talk about respiratory illnesses because unfortunately they continue to be an issue for us. But this is a great graphic here on the left, which shows that pretty much across the entire nation, activity for all respiratory illnesses, and that's specifically talking about COVID-19, influenza, and RSV, is in the minimal category across the United States, and that's really good. You can see that Maine is a little bit higher than some of the other states, but it's still a very low activity. But more concerning is the graphic on the right. Those states that you see in the purple and those that have some greenish color to them, or I'm sorry, the ones that have the purple color to them and the pinkish color to them are actually likely seeing a rise in COVID activity. And that's concerning because we have seen over the last 3 summers that we have had a second blip in COVID cases, not quite as great as what we've seen in the wintertime, but we are starting to see that this is becoming something that may actually be happening every summer. And this might be an indication that we're headed into that right now. Next slide, please. So this is just the respiratory illness tracker for the state of Maine. Again, this is all 3 combined, but then they break it out into COVID-19, influenza, and RSV. And thankfully, all respiratory viruses remain on a decline at this point in the state of Maine. But again, it bears watching for us what's going forward for the summer. Next slide, please. And I do want to talk about FLIRT because it's making a lot of noise out at least in the media. It is not a new lemon lime soda, but it is unfortunately a new collection of COVID variants. The main FLIRT COVID variant is KP2, and it's the latest in just a long line of COVID variants that begins to take hold and becomes the dominant strain. It is not quite the dominant strain in the United States, but is certainly headed that way. FLIRT is really just a nickname that the scientists who follow these kind of things came up with because they thought it sounded funny after they manipulated the letters of the names of the spike proteins where the mutations have occurred that created this new family of variants. So FLIRT itself has no real meaning other than it's just kind of a nickname. The differences between KP2 and what we've been seeing in the other Omicron families, they may make it more infectious, but it's a little early to report to say whether or not it's been causing any more severe disease. It doesn't look like it is, and that's good news for us. But of course, if it's more infectious, then that's a problem for us. And unfortunately, the current vaccines may be less protective against KP2. Again, a little too early to confirm that, but early data and signaling kind of says that that's the case. So this is my opinion. I anticipate we will see new fall vaccine recommendations, which will include or be exclusive or inclusive of only the KP2 and its family of COVID variants that we're seeing right now. Again, my opinion, but I think that's where we're headed. Next slide, please. And lastly, I want to touch on the H5N1 avian flu. Again, actually just yesterday made even more news. So this is a bird flu virus that's been tracked for a number of years, but unfortunately, recently it was found in dairy cattle in the United States. As far as we know, we've not seen it in dairy cattle here in Maine, but the spread across the areas where dairy cattle is a big industry is a little bit concerning. Currently, the risk to humans is considered low. And most of the transmission would probably come through milk products. The good news is that milk from a known infected cow does not enter the market. It is either destroyed or it is sent for research purposes only. The best way to protect the milk supply is to use pasteurized milk. pasteurized milk is considered safe as it is very effective in killing not only this virus, but other viruses that can be transmitted. The reason why I said yesterday in the news is because we had known that previously there had been at least one person directly infected. There was somebody who works with dairy cows. We have now seen in a second state another individual who was directly affected. And again, they are somebody who works with the dairy cow, not somebody out in the community. So we know that it can be transmitted from cows to humans. We just don't know exactly how concerning that is right now. I will say that in the state of Maine, we have a large number of people who consume raw milk or dairy products that are made from raw milk. And we know that that could result in sickness in humans, not just from the H5N1 bird flu, but from other infectious diseases. And so I put that out as a word of caution, especially as we get into the summer months and then again into the fall, where we have a lot of festivals where I know that there is a lot of cheeses and other things that are made with unpasteurized milk. And I put that out there as a word of caution that we cannot guarantee the safety of things that have not gone through the usual pasteurization process. And I believe that is my last slide, and I'll turn it back over to you, Karen, and I'm definitely available for questions.
Yeah, thanks, Jim. And I do have one question in terms of the H5N1 flu. What are the symptoms? Do the symptoms mirror other respiratory illness, or how would somebody even begin to think that they have this?
That's a great question, Karen, and I wish I had an answer for you. The good news is that really this has not been something that has been infecting humans, and therefore we don't really have a good gauge as to what it would do. In past viruses that typically have been in birds and then transmitted to humans, the flu is usually very similar to the symptoms that we see all the time. People with a fever, they'll have body aches, sometimes they'll have upper respiratory symptoms, and then unfortunately pneumonia. And so we expect that that would be the case. Hopefully we will not see that transmission. I will tell you, this is one of those rare things where our government really gets together because this is a dairy thing. It does not fall under the FDA or the CDC. It falls under the agriculture, and they have the Department of Agriculture, the Department of Interior, and the CDC have all been working together because they really want to contain this before this becomes a problem.
Thank you. And is testing for this available locally, or is this something where if you suspect, it might have to go to the state lab?
You're exactly right. That would be
Yeah.
something we'd have to send to our state lab. It's not something that we would routinely test for simply because, again, it has not been a human disease as of now.
Great. Thank you so much, Jim.
No, thank you.
Just a reminder for the audience, if you have any questions about this topic or others related to health, Dr. Jarvis will be available during the open panel discussions. So please don't hesitate to use the question and answer function to ask your questions of Dr. Jarvis. At this time, I'd just like to move into the topic of today's discussion. And for those of you who have joined us for conferences in the past, this is typically where we would transition to more formal presentations. I'm really looking forward to the change in pace today, as we will be spending the remainder of our time together in an open panel discussion. And there is a wealth of experience to learn from today. Before we dive into the questions, however, I would like to invite Dan to help us set the stage for the discussion. And so, Dan, thanks so much for joining us this morning and being part of the panel. I'm hoping that in addition to setting the stage, you might be able to share a little bit more about your background and the Roux Institute.
Sure, I'm happy to do so, and thanks so much for having me. Hello, everybody. Hope you're having a wonderful day. We're finally seeing some beautiful weather here in the Portland area where I am. So I hope that is reaching all of you as well. My name is Dan Kolosky. I am a professor of the practice in Northeastern University's College of Professional Studies, where I teach in analytics. Prior to joining Northeastern University, which was about 3.5 years ago, I spent a little over 28, 29 years in the enterprise software industry. In particular, my focus was on providing products that were used by IT operations and cybersecurity professionals to predict outages and predict security breaches and respond to those things, which back then involved the early use of what we now refer to as artificial intelligence against IT telemetry to understand what was going on. I now work here in Maine at the Roux Institute. I've lived in Maine for 20 years. It'll be 20 years actually this July. I love living here, and we've really built our life here. And the Roux Institute opened about 4 years ago now. It was announced 5 years ago as an economic development engine for the state of Maine, focused on building the tech and life sciences economy here. which was a mission that was and continues to be very inspiring for me to be a part of. We're doing that fundamentally by three basic things, one of which is my responsibility as head of learning, is developing new talent here in the state. We are focused mostly on graduate programs, so master's degrees, graduate certificates, and PhDs in tech and data adjacent disciplines, things like data science and biotech and bioinformatics and the analytics program that I teach in, project management, computer science. We have a new artificial intelligence program that will start here in the fall. And these are programs from Northeastern University, which is a Boston-based university that has about 35,000 students spread across 13 global campuses. We are one of the global campuses of Northeastern University, but there are many others inclusive of Vancouver and Toronto and Silicon Valley and Arlington and Miami and London, in addition to the Boston campus that many of us may be familiar with. Northeastern University was selected as a university partner for the initiative, which was the vision of Dave and Barb Rue. Dave's a Lewiston native and generously provided $100 million in philanthropy to establish an institute designed to build the tech and life sciences economy here in the state. So learning is one aspect of what we do. The second aspect of what we do is research, focused on essentially bringing more federal R&D spend as well as other types of R&D spend to here in the state. Again, focused in domains that are data adjacent and tech adjacent and life sciences adjacent. And then the third thing that we do here is entrepreneurship. We have an incubator and accelerator program here that is designed to incubate and create new companies. We've done a number of these cohorts, inclusive of being in partnership with Northern Light Health on things like the healthcare, health tech cohort, which is an amazing group of entrepreneurs that are building new companies and will bring also new economic activity here to the state. So that's sort of what the Rue Institute does. Most of my job is teaching and administration. And really, I focus on teaching our students how to think about the use of analytics and AI in business. So this topic is near and dear to my heart. I guess one other thing I'll throw out in terms of background, the Rue Institute did release last year a report known as the State of AI in Maine. We held a large event around that report, and that report, which is available for anyone to read and download, really was an inventory of the different centers of gravity and use cases and examples of what we are seeing here in the state for the uses of artificial intelligence. It's a really nice primer and a grounder for understanding the types of things that people are thinking about as we enter into this new phase of the data economy, which is a really exciting opportunity for all of us. And so I encourage many of you to read that report. It's freely available. I think Karen is going to post the link. Please feel free to use that as a resource in addition to what I'm going to share over the next couple minutes about how we think about artificial intelligence more generally. It is a very headline-grabbing subject right now, and there's a lot of really good information around artificial intelligence. There's also just a lot of mythology and misunderstanding of what it is. So I'll try very quickly to just demystify it a little bit as we get into our panel conversation. When we think about artificial intelligence, the field is not new. It's been around since the 1950s, but it has only really become possible and pragmatic in the very recent last 8 to 10 years, and especially in the last couple of years. Artificial intelligence functionally is a very simple concept. It's using computers to emulate human activity and human thought patterns that result from learned activity, where we use prior knowledge of something to understand something that we don't necessarily know. We as humans do this routinely. We're wired for it. We're amazing at this. Computers traditionally are not very good at this. They're traditionally very good at rules-based, where we write a lot of rules and procedures and tell them what to do, as opposed to giving them a bunch of information that they can essentially learn and then apply to situations that we haven't explicitly scripted. So artificial intelligence is using computers to try to do that. technically, artificial intelligence is fundamentally math. It is fundamentally the use of probability and statistics at high levels of computation to try to do this activity. And it's really important that everybody understands that underlying all of what seems like big, mysterious artificial intelligence is fundamentally math. And because of that, artificial intelligence can be used for lots of things very well and is also not very good at other things. And learning that together is part of what we are all doing as we go through this experience of the data economy together. Now, why this is interesting now, as opposed to for the last 50 years, or really 70 years, where artificial intelligence has been a thing. The reason is because we've had some meaningful changes in the circumstances into which we can use artificial intelligence. The first is that we generate a lot more data now than we ever have in the past. And that's really important because artificial intelligence or any kind of machine learning uses data to learn, and then we can essentially use what we've learned to do something else. So you need a lot of data in order to make an artificial intelligence useful. Traditionally, we produced very small amounts of data on a relative basis, but in the last 10 or 15 years, both humans and machines have produced enormous amounts of data that we can use to make artificial intelligence more useful. You can just think about your phone. So I have a phone here in my hand. Right, that phone produces a lot of data every single second, every single day, which we can use. You know, we didn't have phones that made that kind of output in the past. And so we're producing a lot more information as a human species now than we ever have in the past. Last year, we produced more than the entire history of the species. We'll do that again this year. So that's a lot, right? That curve looks like this. Got a lot more data, and that's really important for artificial intelligence to be useful. The second thing is that our compute, our ability to process, has dramatically increased in speed and capability over the past decade. And that is also really important because for artificial intelligence to be useful, it has to be pragmatically available, meaning I can't say I want to answer a question and need to wait 3 weeks for that answer to come back, which is traditionally the way this type of computation was done. It required a long time. And now we have the ability to do this essentially instantaneously. So when you think about examples of AI that you use every day, right? Voice recognition on your phone is using techniques known as natural language processing, or NLP for short. You can get voice response instantaneously, not 3 days from now. And it wouldn't be very helpful if it took 3 days from now for that computation essentially to work. So our computational speed, along with the rise and explosion in the amount of data, has made it pragmatically possible for us to leverage these techniques, which again are not particularly new, in everyday contexts, in line with the way we live our lives, in line with the way we use our devices, and similar. And so the branches of artificial intelligence that folks are trying to deploy take advantage of these changes. So an example, people talk a lot about self-driving cars. Self-driving cars use cameras to understand what's going on. The techniques are computer vision techniques. They are very computationally expensive. It used to be simply impossible for us to do that, and definitely impossible for us to do it very quickly. And we need a self-driving car to actually recognize a child walking across the street very quickly in the moment, or it's simply not possible. So another example of where the combination of all of this data, as well as the rise in the computational speed, has made it possible for us to do things that we just simply couldn't do before. The most popular use cases for AI that we tend to have seen over the past couple of years, well, I'll back it into two phases. Sort of in the early 2010s to 2015 kind of time frame, we were mostly using what's known as machine learning. And machine learning basically is a set of techniques that get trained on a lot of information and then can use what they've learned from that information and the patterns in that information to essentially make predictions about other information. And we use this commonly in operational processes. We use this in forecasting of weather and stock prices and all sorts of things that you may interact with on a daily basis. And machine learning continues to be one of the most fruitful areas of AI. Computer vision, as I mentioned, is another area of AI, and natural language processing is another area of AI that really deal with sort of different modalities of communication and information. And then recently, in the past several years, we've seen a rise of a new use case for artificial intelligence, which is generative artificial intelligence, generative AI. This is what you're hearing about with ChatGPT and Claude and DALL-E and all of the artificial intelligence programs that essentially allow us for the first time to create new things, not just sort of forecast or use information to be able to make inferences about what might be coming, but to actually essentially generate new things, new text, new images, new music, new words that didn't exist before as far as that particular software program was concerned. That's really quite a novel and interesting use case that a lot of us are excited about. It can do a lot of great things. I think on our panel, we'll talk a little bit about the way people are seeing this stuff play out and what AI is good for and not good for. So I won't steal everybody else's thunder, except just to say that AI is by no means perfect. And again, it is math fundamentally at its core. Math enables us to do a lot of things, but it also explicitly has limits as well in terms of what it is good at and what it is appropriate for. And learning those limits and learning how to operate in them is a big part of what we're all doing now. But this is a fun time to be involved in this industry, really, and in any industry. I kind of feel like it's similar to the early days of the internet, where we really saw something new that nobody was really sure how to use and what might be possible, but it offered an opportunity for something new. And really the last 20 plus years of economic development and activity has been enabled by that internet revolution. I think we're in another one of those now with the data economy revolution. So that's really fun to be a part of. So thanks once again for having me. I hope this was a helpful background, and I look forward to the rest of the panel.
Thanks so much, Dan, and great job kind of setting the stage. I love the internet comparison, and it actually triggered a question that I'm going to come back to you on. And so that was wonderful. Stay tuned for my question. But before we do that, I do want to welcome Dr. Mike Ross from Northern Light Health and Lacey Quayle from PCHE to join us as well. AI is certainly becoming more and more prevalent in the healthcare world. But as Dan noted, it's really in all sectors now, and he certainly has a lot of knowledge about how other sectors in Maine are using AI. So certainly feel free to ask any questions of him from that perspective as well. I think there are many lessons that are transferable from healthcare experience to other industries. So thank you so much, Mike and Lacey, for joining us today. And before we dive into the questions, I do just want to ask you both to quickly introduce yourself and give a little bit about your background and your role in the AI space for your organization. So Lacey, why don't you go first, and then I'll hand it over to Mike.
Yes. Hello, everyone. Thank you for having me. I'm Lacey Quayle. I am an RN. I'm the Director of Care Management and Coordination here at Penobscot Community Health Center. Penobscot Community Health Center is referred to as PCHC, for those of you that may not know. We are a federally qualified health center and are located all around the state of Maine. I have been working here for 4 years. I do have background in nursing in multiple different variations of settings, and I do have a lot of background in primary care and care management. So I've been working with our care management and primary care programs to get more familiar with AI in kind of forms of remote patient monitoring and different things like that we might be utilizing to keep track of patient health and population.
Thank you so much, Lacey. And Dr. Ross.
Good morning. My name is Mike Ross. I'm a pediatrician. I'm also a medical informaticist, which basically means I'm the doctor in between the IS folks, the folks who build the systems and develop the systems and maintain the systems, and the clinical teams, so the teams that deliver care. I'm what's called the Chief Medical Information Officer. So basically working a lot with both sides of that coin. My particular focus on AI has to do with reducing provider and clinical burden and improving delivery of care. Looking forward to talking.
Yes, I am too. I also want to just share as a follow-up to Dan's presentation, I did post a link to the State of AI in Maine report. It's a fantastic report. It really triggered the purpose or the idea of doing today's session because it was just so interesting to hear about how other industries throughout the state of Maine are starting to explore AI. And I know that Northern Light Health, PCHC, might be at different places and points in times in their AI journey. And so I think that that perspective is also very interesting and for our audience. And so I would like to invite you, Lacey and Dr. Ross, just to share what AI is currently being utilized by your organization, just to kind of level set, although most of our questions that will follow are more broad. So Dr. Ross, you want to go first?
Absolutely. So we've usually in a couple different ways. First thing I'd love to do if I can, I want to make sure that when we say AI, we're all talking about the same thing, because AI has such a broad definition. And when many of us think about AI, they think about R2D2 and C3PO and the Terminator and all sorts of different elements. Don't play with that. That might blow up in your face. And that is very true. However, at its core, what AI really is just a really smart predictive engine. When you type into Google, and you begin to search for box of, and it, puts down the next word, box of hamsters, elephants, mice, that's AI. That is the idea of looking at algorithmic and next steps in terms of predictive sentencing. The other thing that it looks at is being able to look at a large language model, basically a large amount of text, in some cases thousands upon thousands of documents, and being able to say, this is what people commonly say in this setting, and being able to apply that. It's not so much smart as it is just so predictive on such a fast scale that it ends up almost appearing like it's intuitive and it's intelligent. And that's when we get into a little bit of the discussion about when is it sentient? When is it that intuitive? So to that end, where we're using AI the most is in documentation support. I use this in clinic every Friday. It is a tool called Nuance DAX and DAX Copilot. It's done by a company called Nuance, which is owned by Microsoft. And what it basically does is it listens to the visit with me and the patient. So I walk in, I say, hey, is it okay if I use a tool that will help me pay more attention to you so I don't have to focus as much on the documentation? Once I have patient consent, I put my phone down in front of me and we have a visit. And I talk to the patient and the patient talks to me, and the toddler or the baby or the child runs around the room as children are wont to do, and the parent gives me the history, or if it's a teenager, the teenager gives me the history, and I am able to spend all the time doing this, focusing on the patient, versus doing this, focusing on the computer and the patient. And I then walk out of the room when I'm done, and I go back to my office, and I find that AI has generated a summary of our conversation. And that's what I build my note from. I make some small edits and reviews, but the time savings and the support savings are tremendous. So that's our major use case. We've got a couple others, but those are the significant areas where we're utilizing it the most.
Thank you so much, Dr. Ross, and I appreciate you kind of level setting too, so we have a better understanding of what we mean and what we're talking about when we're talking about AI today. Lacey, do you want to share just how PCHC is using or exploring AI?
Yes, so we have some providers that are using some of the DAX services as well that Dr. Ross spoke about. But my experience has been more in the care management realm and with working with patients around population health management. So we are using a lot of remote patient monitoring tools, and those are tools that really support different AI databases. We've used multiple AI databases and vendors. And, at this point, it's really just exploratory as an extension of our primary care and care management services. And we're really looking to focus on collecting that data, interpreting the data, providing relief and support to our clinical staff that are supporting those patients. And mainly, we're going to be using it to improve chronic disease management, transitions of care, reducing hospital readmissions, improving access and things like that for patients. So we're able to collect their data from those remote patient monitoring tools. We're able to get alerts from the systems automatically when we have to follow up with patients or things that need attention. We're also able to capture trends and get different interpretations and recommendations from those portals and systems that we're using.
Right. Thank you so much, Lacey, for that. And we can dive into more detail too. If there's any questions about either of those use cases, please feel free to use the question and answer function, and we will dive in a little bit deeper. I do want to kind of follow up a little bit with you, Dan, and then I'd invite others to join in. And it's this idea of that comparison between the internet and seeing as a very similar evolution in our growth in the technology space. And it made me think about back in the day when I was on my PCP playing, I think it was Oregon Trail. And, there wasn't a lot of rules and regulations around the internet and the use of the internet. And I do think that that's creating a lot of unrest in the space of AI, because how do you build rules and regulations when it's evolving so quickly? And so that's a conundrum I think we're struggling with. And I wonder if that's a topic that's come up in conversation around the regulation of AI in the state and in the country, and how quickly can we protect ourselves from those who may want to or may use AI for purposes that are creating bias or creating unsafe circumstances.
Yeah, it's a great question and a complicated question that lots of people are thinking about. So I'll give you a couple perspectives. Here in Northeastern, we have a group known as the Institute for Experiential AI, which is focused on AI research. And that group has a subgroup focused on responsible AI, which is the use of AI in responsible ways, and trying to line out and explore the challenges and opportunities related to the types of questions that you are raising. Some of this may come down to things like regulation, no question. And in fact, the major providers of the AI companies that have been in the headlines these last couple of years have also been very vocal about calling for regulation for themselves, right? So there is certainly a regulatory aspect of the conversation, but I think that is a small, well, a piece, maybe not small, a piece of the conversation. And I'll just go back to the internet example. So both of our panelists just talked about use cases of using AI to solve very particular tasks and optimizations and particular areas of what they do for a living. And it's really important that to remember that when we're doing AI, we are generally not reinventing the entire operation in one fell swoop. We're using it as a tool to make certain things easier, certain things faster, certain things more accurate, certain things more efficient. which is exactly the way we started in the internet. Companies began to use the internet to do very particular things. I want to communicate with customers, or I want to be able to provide a hosting internal knowledge management repository of our documents and contracts and things like that, which is the thing that most companies used intranets for at the very beginning. And the experimentation of all of these small things ultimately added up to the revolution that became what the internet did for all of us. And so these experiments are important. These small targeted use cases that achieve success are important not only because they themselves are successful, but in aggregate, they sort of build the foundation for what we might be able to do on a larger scale. And the internet revolution was that way, and I believe the data and AI revolution is fundamentally following the same course. So why is that important? It's important because in order for us to maximize the value of these things to us, we need to iterate and use them and experiment. And so we have to balance the concerns that we have in terms of responsible use, which are very, very important and valid. And there are steps that we can and should and are taking to address those, some of which may involve regulation, but certainly not all of which. Much of them are much sort of smaller scale at the micro level, at the individual deployment level. And balance that with the need also to try these use cases that make sense. And know that generally is going to be the way this is adopted. It's not a wholesale kind of rip and replace everything you did in your job. It is a targeted, tuned, and optimized use with a human being in the loop. That is the way this generally is going to take place. Dr. Ross talked about, I use this, it makes me better, but I change the notes, right? I am in the loop. Right, very important, right? It's not replacing, it's augmenting, and that tends to be the use case that makes the most sense. And when we do that, then we also bring in guardrails about bias and unauthorized use, because the humans are in the loop, right? We're not taking ourselves out of the loop. So I think that it's a combination of sort of big picture things like regulation and many more smaller things like human in the loop AI in actual deployment that really are going to help us ensure that the best practices of responsible AI are adopted and followed. Malicious actors may do other things, but most of the operators who are using these things today are not malicious actors. They're actually trying to find efficiency gains to make what they do better.
Great, thanks, Dan. And I think this is a good lead into our next question. And we actually had an audience member ask, just because we can, should we, right? It's that dilemma, that ethical dilemma. And so, Dr. Ross, I just wanted to toss this to you. What are some of the ethical concerns that you hear about? I mean, certainly people's health information is some of the most sensitive data that we have. And I'm sure you've heard some concerns shared by either your peers or patients. And how do we navigate that to make sure that data is protected?
Yeah, and +1 for the Jurassic Park reference to that comment as well. It actually got me thinking as I saw it come up about, I may actually swing back around to talk about that and do a little exercise with that. But as Dan said, a lot of this with the guardrails that are in place does a lot to reduce, but not eliminate, the risk of malicious use of AI. But that has to be utilized in a way that is supportive of current processes and supportive of the delivery of care, not as a replacement. We're not looking to have a computer start providing medical care, to providing diagnosis. What we're looking is to be able to summarize, to support, and to enable providers to be able to provide the highest level of care. There's been a number of different groups that have put out policy statements surrounding the utilization of AI. The National Academy of Science, American Medical Informatics Association, American Medical Association. Those are three that I'm very familiar with. And they really talk about 5 major areas. They say it's slightly different in each one, but the first one is transparency, disclosure, and attribution, making sure that you're giving credit to and reinforcing the importance of review, verification of that analysis and verification of that AI generated content, not just running with it, but always looking at it within the framework of the data being presented. Documentation of AI generated data, making sure that you're saying this is AI related and this is not. A focus and a mandate on ethics and equity. AI has tremendous capability to level the playing field, and so looking at that as a major driver, and then continuous monitoring, oversight, and public engagement. So let's think real quick about Jurassic Park, which is, I think, a movie that a lot of us have seen, and let's think about did Dr. Hammond utilize these techniques in creating a slew of genetically developed dinosaurs? Was he transparent in disclosing his plans? Not so much. Did he verify his research with anyone else? No, he brought in specific people just to say this is going to be blessed. Did he document? It certainly wasn't publicly available. Was there a focus on ethics and equity? I think we can answer that one. And was there continuous monitoring, oversight, and public engagement? Not so much, because that led to the whole dinosaurs roaming the island and causing problems. So it really speaks to what happens if you don't apply these kind of elements, and why looking at these different components are so important moving forward.
Thank you, Dr. Ross. Lacey, as we think about PCHC's experience and that connection between the person and AI, which Dan spoke to, what is some of the feedback you're receiving from employees that might be embracing or might be concerned about your organization's shift to AI, and how have you really handled that messaging with your stakeholders?
Yeah, I think a lot of the feedback we got initially, and we thought that our use of AI and these different types of additional tools to support our staff and our patients would be easy to do and easy to add to our processes, but really, they are extra monitoring and work that goes into play for employees to have to monitor and use. So, really learning from that, and that we weren't able to grow it as big as we really wanted to. So specifically for remote patient monitoring, we weren't able to add as many patients as we really would have liked to. We set goals, and, we had different things that we wanted to do with that program, but we were trying to do that with providers and MAs and, nurses working in the office already, and care managers working with other programs and other panels of patients. So we really had to kind of hone in on what the goal was for remote patient monitoring and try to figure out where we wanted our focus to be. And we really had to, take the initiative and the investment rather to tell our employees that this was something that we wanted to do. We understood that it was additional work for them to keep track of all of these systems, but it was really there to support them. And we have decided to add, care teams and super users and, specific people that are gurus on these systems and really do work with the vendors to try to learn them better and give that feedback to make the adjustments. And we are getting ready to add some designated positions to help follow the systems and the tools a little bit more closely, so we can give that feedback a little bit closer to the vendors.
Interesting. And, that kind of prompts the question of the workforce, right? AI is so new. How do we prepare our workforce for AI, and what kind of skill sets are we looking for future state as this technology continues to evolve? And Dan, I don't know if you have any thoughts about that, because I know you're working with a lot of businesses throughout the state that are looking for a skill set that we might not have many of currently.
Yes, sorry, I had to come off mute. Yeah, so this is a big area of focus for me personally, as well as for a lot of us at the RU, as we think about how we help organizations embrace what's possible and do so in a responsible and effective way. As I mentioned up front, AI fundamentally is the use of math and high-speed computation against lots of data. And so therefore, in order to be an educated consumer and user of AI, it helps to have a bit more of what we term data literacy. Data literacy is basically the idea of understanding how data works, what's in it, how can we use it, and understand some of the techniques, not a lot necessarily, but some of the techniques that are commonly used when we're dealing with data, because all of those are utilized inside of an AI at a very high speed. And why this matters is it demystifies what it is that we're talking about. So the workforces that we are working with, a lot of folks are focused on only sort of their practitioners. I have statisticians, or I have data scientists, or I have folks in informatics or whatever, and they need to be expert at these things. And then everybody else just needs to sort of treat it as a black box. But if we really want to maximize both the utility and the safety and responsible nature of this, you want actually more people to understand enough about what's going on under the covers that they can smell test the output, that they can think about where it's going to be most effective and where it's not going to be effective, that they can be an educated consumer. And again, I'll use the internet analogy. I started my career when the internet became a thing, and I was a geek, and the geeks, we had a great time in those first couple of years of the internet, but the internet really delivered value to the world when the marketing people or the operations people or the folks who were involved in delivery of the activity said, I could use this thing to do this better. And that required that they understood enough about what it is that we were doing and how the thing was architected to be able to think up those ideas. And I think that's where data literacy comes in. So we're talking to a lot of companies and working with a lot of companies where we say, listen, everybody needs foundational data literacy. Everybody. Doesn't matter what you do for a living. If you're going to be a consumer of data, meaning, an AI widget is going to show up on your desktop and suggest that you do something. If you're going to be a curator of data, the types of folks who input things into systems suddenly become creators of data. Every time you enter something into a system of record that an AI might use, you've now created the data that AI is going to use. Those people need to understand a little bit about data literacy. Obviously, our practitioners, our data practitioners, need to understand a lot about data literacy and some of the more advanced techniques. But we really need to democratize understanding of this and demystify it across the workforce. And that's a net new opportunity. We did not have that problem or opportunity, depending on the way you want to look at it, a decade ago. Because again, this just wasn't mainstream. It wasn't happening. That's why our programs here at the RU and things like data science and analytics are so popular. It's because we need lots of people that we didn't need to understand this. But in an organization, we definitely strongly urge organizations to think about everybody needing foundational data literacy. And there's lots of ways to get there, but it makes a big difference. In fact, I'm co-writing a paper with a number of folks on this subject right now about how we think about data literacy in industry, because it's really important. And it's simply as yet unaddressed, right? We haven't solved that problem. But there was a time when the internet was mysterious to people too. And we can overcome that with some effort. So foundational data literacy across the board is very important.
Yeah, that's interesting. And Dr. Ross, given that and reflecting on what Dan just said, what is Northern Light Health doing to kind of build our workforce skill set knowledge of data literacy, and also kind of, I hope, minimize some of the anxiety felt by the workforce who feels as though they may be displaced?
Yeah, great question. We've got a multi-pronged approach to that. First off, is we're relying and building on the informatics base that we've built, which really focuses on education, whether it be at the elbow or in more of a group setting or more remote, with our providers and with our patients on what AI does and does not do, keeping to those principles that we talked about earlier. One of the areas that we're also investing in is AI predictive associated with stroke and stroke impact. If patient presents with a radiology finding in this space, what is the likely impact in terms of a vascular accident, in terms of a stroke affecting different parts of the brain? So being able to again fit into that workflow what providers do on a routine basis and be able to enable and support them. So we're really kind of leveraging that very strong support we have for developing and educating there. The other thing that we're doing is we're developing governance specifically around AI. That is still in its early stages, but we've already made some pretty broad strokes associated with that. Like, we're not opening AI up to everyone. We're not looking at it at just enabling ChatGPT and all the other versions within Northern Light Health. In fact, we have those restricted. We are investigating the use of AI on top of important clinical tools. So if folks look at a certain reference publication like UpToDate or Elsevier or something where a provider would want to be able to gather that information, they would type something into the AI on top of that large database. That's open and supported, but we're not just kind of opening that, hey, let me use the internet as my feed. Because we end up getting some wackiness, which I hope to talk about later. So governance in terms of judicious use, significant focus on education, as well as frequent feedback. We do a lot of feedback associated with our providers about what is working, what is not working, and where do we think that AI can lead to some improvements.
Thank you. Thank you, Dr. Ross. And I wish we could talk about this later. I cannot believe an hour has come and gone. We have so many more things to discuss. So maybe, I think I said this last time too, but maybe we need to do a part 2 and maybe even a part 3, because there's just so much to talk about. And it's such an interesting topic. I thank you all the panelists for joining us today, and hopefully we can invite you back. And I just want to remind our audience that you can find recordings of all of our Zoom conferences on Northern Light Health's website. And I hope you found this hour informative and engaging, and a support to you and your employees and communities. And just a reminder, we will email you that survey. We'd love to have your feedback. Our next session is on June 27th, when we will learn more about chronic pain and disease management, and these are certainly topics that impact so many members of our workforce and our families. So please share that invitation with your team and your networks. Thank you so much. Thank you, panelists. I hope you have a wonderful Memorial Day weekend, and hopefully the sun will shine. Thank you so much.